Mhm. All right. Got it. All right. So good afternoon, everybody, and welcome to November meeting. Most likely, unless you want to have a meeting in December, probably our last meeting of the year, and we'll look at a January date. Considering that December usually there's a lot of holidays, vacations, people are away, and not much really goes on. So we'll discuss that at the end. So I've got a few things to share with you today, and then answer any questions as usual, and we'll go from there. So this is what it kind of, there's a couple of not major updates, but a couple of minor ones like the portal login, but that's coming, and I'll talk about that. A little bit of an update from validators and how they're approaching AERs. The topic selection form that I created to be able to communicate for the topic selection process that a lot of you are going through right now, and then Q&A and adjourn. So hopefully I can give you some time back in your day, and we'll see how it goes. So portal login change. This just came out this week. So this is straight from the WSIB, the Health and Safety Excellence portal. You're going to be accessing it from your online services account. So if you don't have one, which I think most of you probably should or do, then basically you'll go into your online services account, and there looks probably going to add a tab there for the login to your excellence program portal. So they're basically integrating all the services, including the excellence program, into the online services, I guess, network or whatever they call it, right? Now, this is not going to happen until February 14th. So this is a heads up that on the 15th or 16th, you send me an email, what happened to the portal? I can't log in. Then I'll remind you that today we talked about that from now on, you will log in through WSIB online services account. If you don't know where that is, if you just go to the WSIB website, so I've got a couple of, so if you don't know where the online services account login is, if you just go to the website, WSIB.ca, and you click login, it will take you to this login, and that's the online services. So if for some reason you don't know where to find that, and this is where you'll log in there as a business, logging in. And if you don't have an account, you'll have to sign up. So this is where you can sign up. If you don't have you'll need your WSIB account number to be able to do that. Or firm number if you have more than one account, or be able to get into it. And then eventually, right now, it's probably, there isn't the tab there, but eventually there, I guess, will be a tab to get to the excellence program. So the more, if I get more information on what the screens will look like or whatever, as they implement this, I will let you know, but it's not until February 14th. So just a heads up. I'll try to remind you in our January meeting, and then because probably before our February meeting, it'll be active. All right. So that's, I don't know if it'll make it easier for you. I don't know, but it'll be like one login, one place to log in for everything for WSIB, as opposed to a separate login for HSEP like you have now, and a separate login for your services. So maybe make it easier. Any questions on that? I don't see anything in the chat that's new. Okay. Minor update, which I just kind of learned about yesterday in my meeting with my account manager at the WSIB, mentioned that validators will be monitoring. This is specifically only to AERs. So if you get an AER issued on a topic, they're monitoring. I guess they're going to set some sort of reminders or whatever. And as the AERs are approaching expiry date, if you still don't have a submission, you'll probably get an email or a phone call asking if you need help or whatever, you don't understand something, clarification. So, it's not just, so it's an added layer, because I've been keeping an eye on that, and I try to track the AERs as they come in. And if I don't see a submission for me for an AER that's coming due, I'll say, are you going to do it, or are you going to let it expire, or what are you doing with it, right? So now you'll either at about the same time, before or after, I don't know what the timing will be, prior to expiry date, of course, the validator will also be doing some sort of a communication, a contact, so that people, because I guess they're finding people lose track of the timing or forget about the ARs or whatever it is. So they're basically going to keep track of that as well, because it goes back, the AER submission, I think, always goes back to the same validator that did the original validation. So they have a list of all their AERs and what's coming due and stuff. So they can keep track of, they're keeping track of that as well. So this is just an added reminder, reaching out to see where the status of an AER is.
James,
Yep.
what's an AER?
Additional evidence required. It's good that you don't know. Well, if you're new to the program, you won't know. But if on first validation desktop, there is a gap or something that needs additional evidence, then they issue an AER, which stands for additional evidence required, with a due date, which is 60 days from the date of the initial validation. And so you have 60 days to submit additional evidence for a second validation for that topic in order to get it approved. Yeah, if you're new to the program, you better reach out to me so that we can get you organized, oriented, viewing some of the videos that we did early on in the program. Everything's recorded, which go through a lot of the processes, getting you copies of the guides and all the documents. So please reach out to me via email. We can connect and I can orient you to the program. And that would be another, 2 reasons why you won't know what an AR is, because you've never gotten one, which is great, or you're new to the program. So
Thank you.
no problem. All right. No questions. Any other questions? All right. So that'll be hopefully just a little bit of more helpful and processing for the ARs. All right. And so the next thing I wanted to talk about is topic selection form. So I think I've reached out probably about 3 times via email to all of you that do not have an action plan for year 2. And, getting trickled in responses, but also the experience has been that, it's saying, okay, here are my topics, send me an email, I send it back, and then kind of lose track. Things change. It's not clear. Sometimes we're not communicating which ones need an a rationale form or don't need a rationale form. Are they new or not new? So this will save a lot of going back and forth. And so just to make it real simple, the process will be, the whole objective of the topic selection form that I created is to facilitate our communication for the selection process, right? So right now, it'll only apply for any of you that do not have an approved action plan. So if you already have an action plan with an expiry date, don't need to do this, because we went through, the couple of emails and phone calls, and we basically worked through and got you approved for your next action plan. So you don't need to do the topic selection form. Okay. But for many of you that are still in the process of looking at trying to decide on topics, then the form I sent out yesterday, you will complete the form, and you will also include, when you send the form back to me, any applicable topic selection rationale forms that are required, and you email the form and the rationale forms, if required, back to me for review. Right? I'll look at it. If it's really straightforward, like 5 topics, they're all new, and it doesn't look like, I need to have a conversation or anything, then you may not even get a phone call. I may just go in. I just may say, okay, please just go in and add them on the portal, and then I'll go in
Hello?
and review them and approve them.
Hi,
Hello.
Robert.
Yeah, speaking.
Oops, I think you need to mute there, Robin. Yeah. So if there are any questions on the form, the topic selection, or the rationale forms, because remember, the rationale form is selling the criteria for like a significant change topic, or a significant change in the workplace, or a significant gap. So we just want to make sure it's written out so that, there aren't any questions around the fact that why we're selecting it, and that in fact, it is a significant gap topic or significant change topic. So I review it, and if we can, strengthen, modify the wording a little bit to make sure, it won't be questioned. You'll get some feedback on the rationale form. We'll fix it up. And then, once we're happy with the rationale forms, then you will go in, do your topic selection, just like in year 1. And then the addition this year is to upload the rationale form. And if you have more than one topic that needs a rationale form, you will need to combine it into one file, combine the 2 forms into one file, because you can only upload one file in the topic selection section of I think it's called topic selection document or something, on the topic selection page on the portal. That's where you choose file and upload the rationale form. It only allows one upload. So you got to combine, if you have more than one rationale form, combine them together into one file and then upload it. Once you do that, and you've clicked off the boxes for your topics, then you got to make sure at the bottom of that page, it says it'll be probably in draft. You switch it to ready for review. That's when I get a notice to look at it. I review everything one last time. If it's fine, I will approve it, and you will get an approved action plan to go on to the next section of doing your PDCA's implementation model document for your topics, and start to work on the topics. And you'll get your expiry date, 365 days from the day I approve the topic selection or action plan. All right, so that's the process. And this is page 1 of the form, which basically reminds you of the process. So the 5 steps I just talked about are right on the form. I also put the descriptions of the categories on the form too. The more detailed descriptions that we went through about, I don't know, 2 or 3 meetings ago are also on page 10 to 15 of the Excellence Guide, version 5, that you all have. So if you want to even look up a little bit more information, and they have a few examples on the 5 categories, you can do it then there as well. And then the form is really simple. At least I think it is. Basically, all you do is put the topic name in here and indicate which category by clicking. If you click your mouse over a box, it'll exit, put an X on it. So if it's a new, you just click here and that's it. That's all you need to do. If it's a significant gap, you're going to click here, and this box is a reminder, rationale form sent. So you're going to send it with this form. So you click there and make sure you do send it, right? Because if I get it and it said sent and I don't see it, I'm going to send you an email saying you indicated you sent it, but I don't see it. You didn't attach it, right? So for significant gap, category 2 topic, you need a rationale form. Category significant change in the workplace category, you need a rationale form. Control of hazard may require a rationale form only if it's also a category 2 or 3. So you could have a control of hazard that is a significant gap. And I'll give you an example. There are a number of companies that are implementing vaccine policies. All right. Vaccine policy is related to COVID-19 hazard, which a lot of you did as a control of hazard topic in year 1. Well, the vaccine policy project qualifies as a significant gap to your current COVID-19 program, which is a control of hazard topic, right? So it would be a 4 and a 2. You can click both boxes. Now, and you'll need, because it's a 4 and a 2, you need a rationale form. Obviously, you only need one to say, look, the gap in our current COVID program is we don't have a vaccine policy, because when most of you did that topic, there was no such a thing as a vaccine policy. We were just actually talking about getting people vaccinated, right? So that could be, you could have, possibly significant gaps related to a control hazard topic you've done in the past, or recent, this one's recent. So, that can happen. Otherwise, a control hazard topic will be new. So it's then in that case, you don't need a rationale form. If it's control hazard, you can click box 4 and box 1, right? Then you don't need it because it's new. All right. And then category 5 is on a previous year, any year, right? Right now we only have one, but on any topic that was incomplete or deferred, you can choose to redo it anytime during the program. It doesn't have to be the year after it got deferred, but as long as it was incomplete or deferred, you haven't completed it, you can reselect it. So it would be a category 5, but if it could still be, even though it's a category 5, it could still be from a previous year, a significant gap or significant change. And so therefore, it would need a rationale form as well. So it could be a 5 and a 2, a 5 and a 3. I guess technically it could be a 5, 4 and a 2, right? Or a 5, a 4 and a 1, because that previous topic could have been, that was deferred, could have been a control hazard topic, right? So, right. So it's possible. All we want to make sure is are you going to need a rationale form or not? But if it was a previously deferred new, you can just click 5 and 1, and then I know not to bug you or ask you a question. By the way, is that was that one that you deferred? Was that a new? Because I won't remember, and you might have the you'll have the information, because everybody's picking topics all over the place, right? But this actually, if we use it year to year, will actually help, because I'll keep it on file and I'll know, in year 2 what topics you picked, right? And if you look at the header, it actually tells me number of years in HSEP, right? So if this is year 2, year 3, year 4, I can keep track of it as well. If you make changes to it based on my comments, please update the version date so that I know I've got the most recent and I can delete the old one. And that way you can keep track. So, we don't have 5 versions flying around. We have the most recent one that we're kind of working on. And so this will help if, we need to have a conversation. I'll be pulling this up on my screen. I'll saying, okay, let's talk about, topic number 3. And, you said it was this, and, we can have a conversation if needed, or we can review the rationale form that you sent with it. That's really what the discussions will be around, just to verifying, the topics were categorized properly, and if you need rationale forms, that they've been sent for review and they're good to go. All right. And there's room for 5 because you only can pick 5, but you get some of you this year opting for 4, maybe, 3, entirely up to you. So, all right. So any questions on how to use the form? So I'll be looking, I've sent it out. I've asked people to fill it in and send it back to me with any required rationale forms. So, if some of you, the odd one of you have emailed me saying, we're going to do it, but I'm probably not going to do it till the end of January, James. Okay, just at least let me know so I don't keep emailing. I haven't seen your topic selection form, or when are you going to do it? If I know January, I have a database. I keep track of everybody. I'll just put a note, so-and-so not going to do it till January, and then I won't bug you till then. Right. But if I don't know, right, you'll probably keep getting emails and eventually phone calls if you ignore my email, right? So that we can get things moving. Right. All right. Any questions? Hopefully you'll find this helpful as well. Keep track of what you sent me, because sometimes selections keep changing from one email to another, or emails get lost. And so this is just this document. We don't really need to upload it to the board. This is just for us to communicate, right? If you did 5 news and they're all new, we could upload it as the topics selection document or something like that. But really what needs to go up, uploaded is rationale forms for each category 2 or 3 topic. Everybody's quiet. We will add this to the library as well. We'll send it to Jennifer after this meeting. If you have any comments, improvements, changes to the form that how we can make it better, please let me know. Always open to making it easier, more efficient, right? That's why I created the tick boxes, so you don't have to type, what the category was or anything. All you got to do is tick beside, so really, it's tick boxes and the name. Now, one thing that's very important when I think of name, please, for control of hazard, this is a very common thing. If you look at the examples, when you pick a control of hazard topic, remember, and I know I've tried to mention this anytime we talk about control of hazard, the title of the topic needs to reflect the hazard. So it'll be, control of hazards struck by vehicle, control of hazards, slip, trip, and fall, right? Not the prevention program, right? Because a lot of people put, control of hazards, pedestrian safety. That's the name of your control program or your policy, but it's not the name of the topic. The name of the topic would be control of hazards struck by vehicle, traumatic injury from a vehicle, sprain and strain from heavy lifting, and maybe your hazard control program is going to be your ergonomics program, right? So we just need to describe the hazard. Okay. The name of your program and all of that, what you've created and all that, that'll be in your PDCA document and evident in the policy you create, if you create one. So, definitely you're going to, do the control program, name it, whatever you want. But when we're submitting the topic, and you click the control of hazard topic, remember, you always have to go to the comments box on the view screen, on the main screen, and type in control of hazard dash, COVID-19, like you did last year, control of hazard dash slips, trips, and falls, so because when you tick off control of hazard in their topic selection, it doesn't define it. Obviously, it's just a generic. As soon as you click control of hazard, it opens up another box for control of hazard. And if you click that one, it opens up, because you can do 5 control of hazard topics. So for each one that you pick as a control of hazard in the comments box, we still have to type in the title of that hazard beside the term control hazards. I think they were working on some way to integrate that into the click boxes, but for now, this is the way it is. All right. Any questions on topic selection form, how to, the expectation? So if I get any emails about topic selection and whatever, and I'll just send you, if you haven't sent me this, I'll just send it, please fill this in. And that way I've got it and I know what you're thinking, what you're looking at, instead of 5 emails going back and forth to figure out, okay, what is it, what category and all that. How are we doing on topic selection? Any challenges, questions? I've had some good conversations with folks, where we start off with 3 and as we're talking, we ended up with 5, which is great. And we can, there's ways that we can play around with things and try to, especially control hazards or significant gap topics. So it's just a matter of thinking, having conversations, look back at, God, year 1 of safety groups. Is there a topic there that you haven't touched in, some of you maybe 5-10 years that may have a teeny significant gap? But, a lot of ones, slip, trip and falls comes to mind. Vaccine policy comes to mind. We've had a couple of, some folks doing adding, because mental health has become a big issue. So doing something on mental health, but one did a significant gap to their first aid program because they're going to train all their first aiders on mental health first aid, which is a certification in itself. So submitted as a significant gap to their first aid topic, which was great. So that's another one that I've seen it come through. Implementing new technologies, sometimes that can be a significant gap topic. Another company has changed their organizational structure, their whole leadership structure. So significant gap in roles and responsibilities. You get a whole different team with different roles now. So you got to revamp that whole and retrain everybody on their health and safety roles and responsibilities. So that's a significant gap. Yeah, Desiree, we need to go over. I think you sent some rationale forms, so we just need to go over them and just clarify them. So yeah, and that's a perfect example of what would happen when I go through and look at rationale forms and the topic selection form. So yeah, just need to schedule a time sometime next week, probably, obviously. I'm trying to think of other examples of struck by vehicles came out. Companies that have had accidents in parking lots and stuff like that in their company parking lot, putting in a pedestrian safety program, marking the traffic directions, training awareness. If you're adding a new line, a new area where you're placing workers, that brings in new hazards. Those could be new control hazard topics if you're going to do some awareness training at your level, right? Around that. So think of that as well, right? A lot of people did wellness, which they didn't really have formalized. And that was either as a new topic, right? Even though you do some activity in a topic, doesn't mean you've got a full PDCA, because a previously done complete topic means you've done a PDCA sometime in the past, some level of a plan, do, check, act, right? So, so just keep that in mind, that if you've never done a check and an act on a topic, then it certainly possibly could qualify as new because you've just implemented it, but you never audited it, right? And then corrected any gaps. So, you know, that could end up being a project in itself. Any other folks that I've talked to that have examples of how we've reinvented some topics that you want to share? Because I know I've had a few conversations. Some of you, I think, on the line do have approved plans. Nobody has an approved plan? I think you do. Some of you do. You can share some of the topics that were maybe a rationale formed, required rationale forms, or that we were able to bring in as new that you haven't done in the past. Nobody? Wow. Everybody wants to go? Is everybody there? Is anybody there?
Hi, this is Julia.
Yeah,
So for ours, for example, one that we did that was new was legal and other requirements.
yeah, that's a good one.
This policy, because we did have in our existing policies how they tied to the legal requirements, but we never had a policy itself
Yes.
that outlined that. So that was new.
Yeah, that's an
and one
excellent one.
But that we had to use a rationale form for was for responsibilities, because our business structure had changed over 2020 and so far in 2021. So we had to outline various additional layers of management that were brought into the business. So we had to ensure that they had a clear framework of their responsibilities and so forth. So that one required a rationale form. But the other one, slip, trips, and we did the controlled hazards again, but slip, trips, and falls.
Yeah,
And the other one was competency, because yes, it was again intertwined with many policies. We did not have a policy
an
itself.
overarching competency policy.
Right,
Yeah.
right. And audit policy, because that one we hadn't looked at in, I think like 7 years or more. So
Yeah,
that one was new as well. So those are our 5. And the rationale form again was just for the one responsibility.
right. Good. Thanks for sharing that. Appreciate it. Yeah. Yeah, the legal responsibilities is a good one because it's a whole formal process of keeping, you know, basically a matrix or a tape, you know, of all the standards that you have out there that have legal references and keeping track and updates. So it's a really good exercise, I think, you know, that if you don't have a handle on all the legal requirements in one place, you know, we tend to put them in all the different policies, but how do you keep track of what's in where, right? So so that I think, you know, if you're struggling, have a look at the write-up for that one in the guide. But that is a good one. Thanks for mentioning that.
No problem, especially now with COVID-19, and
Yeah.
we look at a national.
Oh gosh.
So
Yeah.
many, and thank goodness it's tasked to another member in my HR department. So
Yeah.
that's
Yeah,
why
in many companies, there's somebody like larger firms, they have what we call regulatory affairs person who
Right.
looks after all
right.
regulatory, whether it's, you know, everything from consumer product to safety to whatever, environmental, that's their job,
Right.
right? Because there's just so much out there.
Yes.
Okay. Yeah, control. Yeah, that's a common one too. Control documents, control records, 2 separate topics. Sometimes they're rolled into one policy. You can do them as separate policies. So that's an excellent one. Vaccine. So somebody's doing a vaccine mandate. Good. And workplace. What's WFH? Oh, work from home. Yeah. Yeah. Oh, that's an excellent one. So a lot of people are going to hybrid models. So if you are doing that, there is a whole, we just need to, it's a control of hazard. We just need to identify a hazard, right? So it could be ergonomics, like a, a musculoskeletal injury, from working on a workstation, right? Prolonged sitting, just tie it into one of the ergonomic hazards. And then obviously the control program may address more than that, but it's a work from home policy around health and safety, right? So that's a good one. Okay. It might be worth noting that seminar about enforcing vaccines on our workers. Yeah, there's been a lot of webinars and stuff about vaccine policy. So I'm sure most of you or whoever's are making sure that your lawyers, look at it to make sure, just the legalities around it and the human rights aspects, even though it so far it's been very clear that, the perspective of the greater good overarches the risk. So as long as it can be justified, I think it seems that seems to be the thinking these days. And I've got a lot of large companies that are doing mandates on it. We're hearing all the school boards. I think I just saw the news this morning. Toronto School Boards is putting 330 staff on unpaid leave as of whenever, I think it was next week, or because I think today or something was the deadline. TTC, we've heard in the news, is doing same thing. So it's happening. And so far I haven't heard any successful human rights cases yet. So, but the whole process of doing it, the requirements, the training, the awareness, some people are doing PCR testing or rapid testing, and the process for doing that. If you're not fast, you don't have your vaccine, then you've got to do it. You got to do it 3 times a week. And and where do you get the kits and all that? So you need a whole program around this thing. I mean, it's not just saying, oh yeah, sending out an email saying, oh, as of tomorrow, everybody's got to have it, right? It's I wish it was that simple, right? So there's a lot of logistics, and that's why it warrants PDCA as a significant gap to the existing COVID program. Good. Thanks for sharing. See what happens when you can brainstorm a lot of good ideas. Right. Right. And I always tell people, look at your accident stats. Where are you having accidents? Because that's what you should be focusing around, improving your safety program, right? So, and that, could easily turn into a topic, because most of the accidents come from a hazard. So that's where control of hazards is a good one to repeat. All right. Any other questions, comments, input? I'm assuming everybody's okay not having a meeting in December. I don't have to take a vote. Considering if we have it, it'll be the end of December and everybody's probably on vacation on Christmas Eve, right? So, so I was actually looking at January, probably by the time everybody gets back and gets organized and acclimatized to being back to work, probably sometime the end of January or first week of February. I'm tied up, I think, pretty well most of the last week of January. So it's either the second last week or the first week of February. So
looks like January is good for everyone, James.
yeah. mid-January, like January. I don't know. We didn't really settle on what's a good day of the week I mean, I don't mind, like a Friday is Friday's okay, or do you want to switch it to yeah, I got a first week of February is good too. Okay. So why don't we do it the week of January 31st is technically the first week of February. Yeah, how about let's just do a little bit of a vote. Is our Fridays okay? Type yes or no in the chat. And we'll Fridays work, Friday at 1 o'clock. We usually go about an hour, right? So you want to do them in the morning, or is 1 o'clock? So Fridays, nobody said no's. So let's do another poll. Okay. Morning or afternoon? So type morning or afternoon. Afternoon. Okay, afternoon, good. Okay, so January 4th at 1 p.m. Or is that,
February 4th?
oh, sorry, February 4th. Yeah, people will still be on vacation. February 4th at 1 p.m.
Okay, I'll send that invite out.
I should probably double check my calendar before I commit to that. Let me just fast forward here to February 4th. Yep, good. All right. And I certainly hope that, we have most of you by then with approved action plans. So between what's left of this year and, the first couple of weeks of January, hopefully we can get people with approved action plans so you can start working on them for the year. So 1 p.m. All right, February 4th, 1 p.m. it is, Friday.
James,
Well,
what's the
yes.
best way to get a hold of you?
The best way, email or phone call.
Okay, what is that?
Why don't you call me
Uh-huh.
so that we can have a chat and we can set up 416-270
Okay.
7689.
Great. Thank you.
Easier than trying to spell out my email. I could have always typed it in the chat, but yeah, give me a call. We can get organized and then set up some time to meet. And then I can get your email and all that kind of stuff and send you out all the documents you're going to need, because you're going to need access to the portal and all that stuff. So
Perfect.
we'll get you sorted out.
Thank you.
All right. Anybody else? Any other questions, comments? Give you back about 15 minutes. All right. So since probably some of you I won't be seeing or talking to till January now, then I'll wish those of you who I don't see or talk to a very happy holidays and well-deserved rest, I am sure. Enjoy and be safe. Follow all the rules that keep changing as we move through. So happy holidays to everybody. And
Same to you.
yeah, we'll talk to you in January or in February, if not before. All right. Have a great